Hi everyone, and welcome to our webinar, How AI Automation is Transforming Patient Demand and Healthcare Institutions in 2021. I'm Milan, the Head of Growth at EBO, and I will be your host for today. Now, by the end of this webinar, you're going to walk away with the following top 3 takeaways. Firstly, you're going to understand how AI automation is transforming patient services to be more faster, more efficient, and more accessible. Secondly, you're going to see an AI virtual agent live in action. And thirdly, you're going to understand how a healthcare institution such as St. James is transforming its patient services using AI automation. Now, before we get started, I would just like to take 1 minute to introduce you to our panelists. So first of all, we have Dr. Gege Gatt, who is the CEO of Ebo.ai. Hi, Judge. We have Jean-Claude Muscat, who is the CEO of St. James Hospital. And we have our product director, John Deguara, who will be showing a little more about our AI virtual agents shortly later.
Thank you, Milan, and thank you all for joining us today. Well, Milan, AI doesn't simply improve the way businesses operate, but it does improve the way that they deliver value. It improves decision-making, and it really provides the tools necessary for real automation. However, the real opportunity which is ahead of us is using artificial intelligence on top of EPR and AS systems, thus on top of medical records. This is the next evolution in digital transformation, and doing so allows us to achieve 4 things. The first is allowing us to reduce operational costs. The second is the ability to improve the quality and the speed of the delivery of care. And thirdly, what we do with AI in this sector is increase the involvement and agency of patients within the care process. And we know that typically as agency increases, healthcare outcomes better too. And lastly, what we try to do with the use of AI on top of medical records is optimizing the level that patient satisfaction scores within the entire medical process.
Thank you, Gege. I would just like to take the question to Jean. So Jean, at what point did you realize it was time to embrace the opportunity for AI innovation at St. James Hospital?
Hi, Milan. Hi, everybody. Thank you, Gege, for the intro. Well, we've been hearing about AI. It's become the buzzword in healthcare for a number of years now. But from our perspective, I feel what was happening was it was being presented to us in a way as if it was something from science fiction, something which was not so attainable, not so realistic. So what happened is, as we progressed, as we grew, the processes we use became more and more complex. We are a very highly regulated industry. So healthcare is a very highly regulated industry worldwide. And any private hospital aims to provide optimal patient care and patient safety. I would say patient safety first and patient care secondly. Patient safety, why? We just simply cannot afford to have one single error. We can't afford anything going wrong, because it affects our reputation and it has dire consequences. When a patient comes to a private hospital, they're also looking for patient care. And patient care is the experience that the patient perceives throughout his meeting people, interacting with departments, with staff, employees, and so on. This makes our industry very heavy on human resources and very heavy on technology and medical equipment. So the challenge that I feel that we face nowadays in today's world is in order to keep up with regulatory processes and the complex or the high number of employees that we have, is that we need to, we're depending a lot on employees, and we need to simplify processes. We need to reach a level of consistency, which is very difficult to achieve when you have staff turnover, when you have high number of employees, when you have pressures. So this is really what started to lead us to consider technology which simplifies processes, which improves the patient experience, very much in line with what Gege was explaining in the opening statement or question.
Fantastic. Thank you for sharing that, Jean. Now, Gege, let's talk about AI enablement. What areas of AI do you particularly focus on and why?
Thank you, Milan. That's a great question. Well, I think if you look at AI in healthcare, it is typically understood to act in 6 different sectors, which you are seeing on screen now. EBO specifically focuses on the 2 areas marked in blue, which relate to the delivery of the care process and the self-management by the patient. So our solution intends to redefine that very delicate interface that exists between the patient and the hospital or the healthcare provider. So we present an AI-driven virtual agent that really seeks to deliver the care process and seeks to empower the patient in self-management of very key use cases within the hospital. So we found, to your question, that time and time again, complex administrative workflows that exist within hospitals, often bound by legacy technology, have a large amount of associated inflated costs. So we utilize AI to essentially deliver process automation, and this is centered around patient conversation. So what our virtual agents do is pretty much indistinguishable from a human agent. And even our own virtual agents continuously improve their learning on how to perform their tasks more accurately and efficiently over time. So the more they interact with human patients, the more they learn, right? Similar level of cognitive capability that humans have.
Thank you for sharing that, Gege. Now, Jean, I would just like to take the question to you. I'd love to know a little more about Jamie's role at St. James Hospital. What area does Jamie help the hospital with?
Okay, so as I was explaining earlier, Jamie was introduced to help us become more efficient in our call center, where we're facing major issues. So Jamie, we met with EBO, discussed our issues, and EBO said, we have a solution to your problem. So we were a bit skeptical about it, and we said, okay, let's learn more about it. We really needed to solve this problem. And basically, Jamie is our virtual agent. We named him Jamie since our hospital is called St. James, so Jamie, James. So there's some familiarity there. And then we were asked to give him a personality, so we chose a guy, and he has to be friendly, and so we got to see this Jamie as another agent. We stopped seeing him as something, out of this world, as a robot. So what Jamie does is basically Jamie is able to handle patient bookings. So what happens today? Today a patient needs to contact the hospital, they pick up the phone and dial a number, and they have to wait in a queue until they are taken by one of our 50 agents. In the case of Jamie, all people have to do is contact the St. James via Messenger or just by scanning a QR code, and they are immediately connected to Jamie, who asks them what he can do to help them. They say, I need an appointment for this and this, so they need to change an appointment, it's all done automatically from the comfort of wherever they may be at the time. And so Jamie is able to handle a vast number of calls, which then relieves the pressure which we were experiencing on the individual call center agents.
Fantastic. Thank you for sharing that, Jean. Now, Gege, let's talk about some of the problems that people face on the ground. In particular, what are the real client-facing, process-orientated pain points in hospitals that you see them being experienced?
I think that's a really good question, and Jean has been leading on to this point by talking about the overwhelming amount of inbound requests which come in, especially in moments of pandemic like we're going through, but also other forms of spikes which occur naturally, such as seasonality. But well, the problems on the ground that we see when we implement similar solutions to Jamie are these two. Well, first of all, staff are truly overwhelmed. Administrative staff in particularly are often broken morally and emotionally because of the amount of activity which goes on in trying times such as the ones which we're in. But we see this also with physicians. A lot of physicians are spending time on administrative workflows rather than the areas which they are most focused on, which is medical care. But we also see that on the ground, patients don't feel in control. Patients often forget 40 to 80% of the information which is provided to them, Milan, and subsequently they don't turn up to their appointments or they turn up unprepared, which in turn reduces the efficiency of the workflow once the patient gets to the hospital. So we also find that patients feel out of control because they can't access or provide data easily to the hospital, right? From the simplest and most natural messaging channels that they are used to using every day.
Jean, I just want to ask you from the perspective of a healthcare institution. So as a patient myself, I'm quite aware that healthcare institutions sometimes face pain points such as not being able to serve customers potentially out of hours, or sometimes there may be a language barrier, or sometimes there are issues where they miss appointments for whatever reason. So I'm particularly interested in your case, that how did you find that Jamie eradicated these pain points at your particular hospital?
Yes, not only out of hours, I might say, even during working hours. These are the challenges that I was referring to earlier on. And they're particularly sensitive to patients who are trying to get a service from a private hospital such as ours. So for a patient who is waiting for 2 hours, 2 minutes, or else even worse, the line actually goes dead, while you're waiting to fix an appointment with a doctor, gives a very bad impression to the patient. This is the first point of contact with our hospital. It's even before meeting the reception. So for us, this call center is of crucial importance. And this is why, probably what led us to actually involve AI in this particular department. From all the departments we have in the hospital, we felt that this was the most pressing area.
So now moving on to Gege, for our next question, how do you feel a hospital actually gains operational benefit?
Yeah, I think that's the key point here, which we want to address. And I think there are 3 areas which are critical to discuss here. The first one is that the solution which we provide delivers value in mere weeks from contracting. I think gone are the days where you need to involve your entire IT team and rollouts take months to even happen, let alone provide benefit. So we deliver value in often just a few weeks from contract signing. I think that is incredible. So we've seen cases where our outcomes have been quite exceptional. For example, automating 60% of all inbound flows within, let's say, 2 months. Or, for example, reaching a return on investment neutral point within 5 months, where the system pays itself off. So I think one of the key operational benefits here is that there is a low level of complexity, but a high level of value which is delivered. The second point actually relates to the relief of burnout. Milan, our healthcare workers are really, really burnt out. Perhaps quite importantly for the world which we live in today is this concept of resiliency, right? Especially in and post-pandemic period. So our solution increases the resilience within a hospital because it gives the capacity to grow and to scale without the necessity of human intervention. So if COVID had to happen again tomorrow, and new to a hospital which is already using a virtual agent, well, that hospital should be rather unfazed by the inbound spike because there's a degree of automation which is enabling, right, that resilience within the entity.
And John, in the context of operational benefit, I understand that you said very interestingly that Jamie deals with thousands of patient queries a month. How do you envision this progressing across 2021?
Yeah, that's a very valid question. In fact, a point I wanted to emphasize is that this is not something which becomes successful overnight. Okay, so this is a process. There's a learning process from our side, there's a learning process or an acceptance process from the patient side as well. So to be perfectly honest, when we came to the end of our completion of the project, launching Jamie, we were expecting, us guys in-house, we're expecting a very huge take-up by patients. In reality, it was much slower than expected initially because patients were not aware of the service, were not aware of Jamie. So we found ourselves having to promote it more aggressively than we had planned initially. because that's the only way to achieve the benefits, to reap the benefits of Jamie. And we were then happy with the take-up. And what we have realized is that patients who use Jamie return and they are using Jamie as their standard booking channel, let's say. Today, Jamie is handling well in ahead of 80% of all bookings being done, which is very, very, very effective for us. We, going back to what Gege was saying, I wouldn't underestimate the burnout effect that employees do experience. I'm sure that even our participants are very familiar with this, but the contact center environment is very stressful. And this is one of the problems we are facing with very high staff turnover. Also, I can share our experience during COVID, since we're all medical people here in the medical field. So when COVID hit us around March in Malta, suddenly our agents were overwhelmed, were completely overwhelmed with calls of people wanting to undergo the COVID swab test, the PCR test. And we just couldn't manage it. So we contacted Evo and we created a specific channel to book so that patients could book online and be given appointments there and then. And with just one virtual agent, this guy could take 15, 20, 30 calls, bookings at one go, and it relieved a huge amount of the stress from the agents who were tearing their hair out. So that was I think that's a very practical and realistic experience, where it was hugely beneficial for a short period of time when we really needed it.
Brilliant, thanks. Thank you, Jean. It's quite natural that hospitals have questions surrounding security. Perhaps they have questions surrounding how staff will engage with Jamie, or even questions surrounding the implementation of a new technology solution such as AI within a hospital. So how did you find that Jamie fitted in within the healthcare ecosystem? If I'm not mistaken, I believe you use CompuCare. So how did you find the integration of the technology solution within your hospital?
Correct. We do use CompuCare as our hospital information system, and it's a very, very relevant point. In fact, this was probably our biggest, stumbling block at the word go, at the onset of the project, I would say. So as a company, our style is we're rather innovative. We're very forward thinking. We've introduced several firsts when it comes to healthcare services on the island. And so when we were presented with Jamie, when Ebo presented the concept, the virtual agent concept, we put a team together, which was made up of our hospital information system administrator, which was made up of our IT, head of IT, and our head of the call center. So what we like to do is we like to have small teams at the beginning of large projects, and then we enlarge the team and the scope as we get closer to rollout stage. The problem is that most employees tend to be a little bit conservative initially. So when we're going for a big change, we're moving from the human element to the virtual element. As Gege very correctly explained, it was never and it is not our intention to replace the employees in any way. It is more there to support and improve our efficiencies.
Now, John, I wanted to ask you more about the context where Jamie fits within a healthcare ecosystem. It's quite natural that hospitals have questions surrounding security. Perhaps they have questions surrounding how staff will engage with Jamie, or even questions surrounding the implementation of a new technology solution such as AI within a hospital. So how did you find that Jamie fitted in within the healthcare ecosystem? If I'm not mistaken, I believe you use CompuCare. So how did you find the integration of the technology solution within your hospital?
Correct. We do use CompuCare as our hospital information system, and it's a very, very relevant point. In fact, this was probably our biggest, stumbling block at the word go, at the onset of the project, I would say. So as a company, our style is we're rather innovative. We're very forward thinking. We've introduced several firsts when it comes to healthcare services on the island. And so when we were presented with Jamie, when Ebo presented the concept, the virtual agent concept, we put a team together, which was made up of our hospital information system administrator, which was made up of our IT, head of IT, and our head of the call center. So what we like to do is we like to have small teams at the beginning of large projects, and then we enlarge the team and the scope as we get closer to rollout stage. The problem is that most employees tend to be a little bit conservative initially. So when we're going for a big change, we're moving from the human element to the virtual element. As Gege very correctly explained, it was never and it is not our intention to replace the employees in any way. It is more there to support and improve our efficiencies. So in reality, I have no doubt, and I don't mean it by means of conclusion, but I have no doubt that now that we've been exposed to artificial intelligence in what I would refer to as a practical way, something that a layperson, a non-technical person such as myself understands and now feels and can see functioning every day, I believe that this will be, I can see it filtering into other areas and other functions of our hospitals, and not just our hospitals, but all hospitals across the world.
Thank you, Jean. Now, while on the topic of talking about how the AI solution fits within the ecosystem of healthcare, I'd just like to now take this conversation to John Deguara, who is our product director. So John has a very interesting demonstration where you can actually see the AI virtual agent in action. And I believe he's going to show us how it actually works within the NHS ecosystem to kick it off.
Hi, Milan. Thanks very much. I've got two quick demos, basically. One which is focused on the NHS and a workflow that we're implementing there. And then we'll see Jamie in action. We've heard a lot about this virtual agent. Let's see what he can do. So the first one is that was given the name Alex, and this is at Somerset NHS Foundation Trust. As far as a representation on a website, we thought it was a good idea just to give an idea. There would be a chat now button of form, as you can see on your screens, and the virtual agent would then appear when selected. Now, this is obviously a bit of a mock-up, but this is an example of the kind of introduction that you would get and a highlighting of which services the virtual agent is appropriate for on launch. Now, we've zoomed in a little bit here in order to support you guys watching exactly what is happening. Now, over here, you see the implementation of what we call a carousel. And that allows, if you're on Facebook Messenger or WhatsApp, you can flick between them. But on the web as well, you can move between the options that you have. But we like to suggest that people actually type in the questions instead. Now, this first one here is actually a type of FAQ, which is really can be the bread and butter. It is the initial part, no integration required. And what it does, it can take away that initial 10, 20, 25% of calls that come into the call center. And this kind of FAQ is where we start. We try to make sure, as Gege mentioned earlier, we try to add value as soon as possible. If we get the virtual agent surfaced on your website and we can take away a big chunk of the work that's going in, then we can do so without any integration. And then as time goes on, we can build further and further. So that was the first one. That was a simple question, who can come with me? We're using artificial intelligence in order to understand. So we're actually capable of understanding 95% of what is asked of the virtual agents, which is obviously extremely good number and allows us to have decent conversations with our patients. Then the next question I was going to ask is, where will my appointment be held? Don't worry about spelling mistakes, thankfully in my case, because my typing is shocking. But in this case, in order to understand where the appointment will be held, we have to authenticate the patient. And we do that via two flows. The flow being used here would be using the NHS number and would be using the date of birth. This is to validate the patient via the two-factor authentication, and this is done via mobile number, which will be held within the patient record. We go in, we identify the mobile number, fire off a PIN to that mobile number, and once the patient is able to enter that, then we have validated and seen what appointments that patient has on the system. Those are then presented to him, and he can select to the patient, and the patient can then select which appointment they would like to know the address for. Once we select one, dynamically, that address will be pulled from the database and displayed to the patient. And then you have the option of seeing the other locations for the other appointments. In this case, we just move on quickly. What should I wear to the appointment? Again, because it is dynamic, we present the appointments, and they select the appropriate one. In this case, it's to do with podiatry, and it's informed, so please wear trousers that can be rolled above your knee. Finally, in this flow, I'm going to show the first level of how we would do the appointment management. I need to reschedule my appointment. Again, the appointments are displayed, and the patient can select one. Once they've selected one, in this case, what we would do is we would fire off a request to an inbox within the hospital, and then they can process that request. The request that would actually reach the inbox in that hospital would actually include all the details needed in order for rescheduling to occur. And that's the basic flow that we're implementing currently within the NHS. The plans are, in the next quarter or so, is actually to take that up a notch and actually have the appointments cancelled, booked, rescheduled within the databases directly. So this would be the actual the notification that would go to the inbox. It has all the details in it there. I'll just point out the view conversation at the bottom. That will take him into the portal of EVO, and they'll be actually able to see the full conversation that was between the patient and the virtual agent.
Thank you, John. So John, we've spoken about Jamie a lot throughout this webinar and how it's being currently implemented at St. James. So we would love to all have a look at Jamie and see what he's capable of doing.
Sure. Let me quickly go through what Jamie is capable. Jamie is actually a really good example of taking everything up the various notches that we can go when it comes to actually programming the virtual agent. And I'll explain as we go. The flow in this case is booking an appointment, but I'm going to highlight the kind of things that are going on in the back scenes. So you can ask for an appointment with Jamie for a specific area. In this case, I need an appointment for my diabetes. The first thing you will see here, it's actually given the option of first available clinician. Why? Because it has understood which clinicians will be able to service that specific request. You can then specify which location you would like. In this case, we hit any, and this goes into the database and works through all the logic that there is with regarding the creation of appointments and services up the appropriate appointments with the various clinicians that can service that request. This kind of business logic is all held within the virtual agent, and it's constantly liaising with the patient administration system, CompuCare in this case. You can actually create a new patient at that point if you've been there before. If you have been to the hospital before, then you've got the same two-factor authentication process using the mobile phone. And it confirms it via the PIN, and that will book the appointment directly in. As you can see, endocrinology is the appropriate specialty for diabetes. It's helped select the appropriate clinician. And then the booking is made directly in there. And the same way as the booking can be made, you could reschedule your appointment, you can cancel it. And this is basically exactly how Jean described earlier, taking a significant weight off the booking office.
Fantastic. John, thank you for sharing that. I do have a couple of questions that have come through to me directly that, John, if you don't mind, I would like to direct them towards yourself. So the first is, what happens to conversations that the AI virtual agent can't handle?
It's a brilliant question and a really important one. Even we're very proud of our product, but even in the best case scenarios, we're hitting 80% of the calls coming in are being handled by the virtual agent end to end. That is the absolute best case scenario we've hit so far. That still leaves 20% of the calls that we need to deal with. We've built in a whole chat functionality as well, where a human agent can take over that conversation. Now, that can be triggered in a multitude of ways. You can either have red flags within conversations, especially when you're dealing either with mental health or you're dealing with specific patients who are vulnerable for one reason or another. If specific red flags come up in the conversation, you can immediately move to address that with a human agent, even a specialist team. The routing can be dynamic, so it's specific to the conversation which is being held. And there is a whole flow of how those conversations can move from the virtual agent to human agents. And human agents can manage a large throughput of conversations in the back office should that be required.
Brilliant, thanks, John. I've got another question here, which says, what happens if we need to update something quickly?
Another great question. EBO is not interested, and it shows in the areas that we've gone into. We've gone in, especially in health. We're not actually interested in just providing a product out of the box, which is then provided and we let go. It's the opposite. We have a whole service layer provided, and we have people both analyzing the information and the performance of the virtual agent and liaising with the hospital to see how to improve the virtual agent. Now, this takes two forms. It can be reactive based on the data, and we improve the performance of the virtual agent. And it is also can be proactive, whereby the hospital can inform us of either a drive with regards to vaccination or a new dialogue that is required because of upcoming services or new services. These will all be built into the system in time for the launch of the service or for the vaccination drive, etc., etc. So this is very much part of what we do. It's a big reason we're in the game.
Thanks, John. And how does the AI learn?
The AI learns in a multitude of ways. It is actually built into it, but the key element that we're constantly doing is we're identifying which statements are not being understood and why. And we're constantly building on that training model. So that is never something which is stationary. The virtual agent will always be performing better from an understanding point of view this week than it did last week.
Thank you, John. Thanks for sharing that. So I'd just like to wrap this up with some concluding remarks from Gege. So Gege, what do you feel drives EBO's vision?
So I think this is the key question to us, because we have a solution, Milan, that has so much value. We want to identify hospitals that want to make a difference, that want to improve the engagement with the patient and the outcomes from the healthcare institution itself. So we do believe 4 key things. The first is that data is accelerating the structural changes in business and in society, right? And that secondly, the benefits of artificial intelligence, which is built and informed out of big data, should be available to companies of all sizes, whether small or large. Thirdly, we do believe that through automation, we can create better safety results, better efficiency levels, and better service quality for our patients. Lastly, our 4th tenet of our vision is that we believe that providing true personalization, where the hospital can speak to every patient before and after an appointment, is critical to the overall experience that hospitals need to engineer in 2021. In a nutshell, Milan, what this means is this: less cost, less risk, but higher value to the patient and the hospital.
Fantastic. Thank you for sharing that, Gege. I just want to say that at EBO, we're committed to harnessing data, improving the staff and patient relationship, and enabling self-management by automating all those repetitive queries that healthcare hospitals, institutions get. Thank you so much for joining, and until next time, goodbye.